answer the question about the fact that you may have hotspot within a city, within a country. Of course, you can have places in rural areas where the level are different, but the annual mean is really to try to give an idea of the long-term exposure, which is what we are interested in, because you have a lot of health impact that you can only assess over the long term. I'm speaking, for example, now about lung cancer. With acute episode of air pollution, you can have a different health impact, but on the long term, you have a wider range of health impact, which are especially costly also for the societies and in addition to human health, of course. And this is what we are trying to monitor here. A last point I wanted to mention was the rural area. At least for particulate matter, rural area are not necessarily less polluted than urban areas. I mean, they are, because there are less people and there are less sources of air pollution as such, if you wish, namely NO2, for example. But when it comes for particulate matter, you can have rural areas that are very much polluted, for example, with the household fuel used for cooking, household fuel for eating, and this also impacts a lot people in rural areas. So we should not, even though we call this database the urban, it's very well known as an urban city database. It actually contains a lot of settlement. We call it settlement because of the definition, that are very small in size. So. Yes, it's not comprehensive for the entire world, but it also gives idea about stations that are about cities that are, or towns, if you wish, or settlement that are in more rural areas. And you can see normally in the Excel spreadsheet there is an indication of the type of the stations used. Over.
Maybe if I can just one additional point is that the methodology we use is satellite data, as Sophie was saying, and for that we have different partners that are helping us, including the NASA. I mean, we collect the satellite data and responding to the questions we have. Then we do mathematical models, and we use that as well to calculate the exposure. And then we have the ground measurements. So using all of those, we are able to reach the conclusions that were presented, as I say, based on many years of scientific evidence and many groups working into that. But in addition to that, I think it's important to stress the point made by Sophie that maybe something that we don't know, but or is not, the knowledge is so well shared. The fact that almost half of the world population today is cooking or heating or lightening their houses with very polluted fuels and at home, so at household level. So that contributes enormously to this air pollution that sometimes we don't think that is happening at the rural areas, and obviously we look at rural areas where there is a concentration of population. So I hope this answers your question. Thank you.
Yes, thank you. Can I just, so doubly checking, you're including indoor pollution caused by cooking and heating and open fires, for example?
No, it's a tricky question. Household air pollution, what we call household air pollution, is the pollution caused by the combustion of household fuels, right? So this is as such a topic that we treat as separate from ambient air pollution, because it has a lot of wider impact in addition to the household air pollution, but also to, anyway. But the problem is that household air pollution is not only people who cook inside. They may also cook with open windows or in place or just outside the house. However, it does contribute. It is a huge source also to ambient air pollution. So it is a source of exposure indoor when they cook indoor, but it also goes out, and it also contributes to the local air pollution and then to the global. So this is why this is considered as a source of air pollution. I mean, this is one of the. I mean, household fuel combustion is one source of ambient air pollution, but it's also a topic in itself, because it also links with access to clean fuel, it links to equity, it links to gender, it links to poverty, to etc., to different aspects that WHO likes to consider as well. I hope it did address your question, but yes, household air. residential fuel use is one big source of air pollution in some regions.
Yes, thank you so much, Dr. Gumi. And Clive, of course, if you do have any follow-ups, please don't hesitate to email us at mediainquiries at who.int, and we'll be sure to follow up as well. Our next question goes to Lisa Schlein. Lisa, the floor is yours. Thanks for waiting.
Thank you very much. Appreciate it. Hello, Maria. So nice to see you. I have a few questions. Yeah, you were touching about if you could perhaps draw a distinction between the main sources of pollution between developed and developing countries. I'd like you to talk particularly about the situation in Africa, please. And what are the major health threats? Do you happen to have a figure on how many of the 7 million deaths occur in developing countries as compared to developed countries? Because you do mention that the situation is worse in those regions. And then, if you would please, in a kind of user-friendly way, talk about the actions that need to be taken in order to reduce air pollution, whether this is feasible in both developed and developing countries. Thank you.
Thank you, Lisa, and nice to see you too. Let me try to start by the end on the actions. I think it's probably one of the most exciting ones, because this is where we need to move, and that's the purpose of raising awareness about air pollution. I think more than ever, and I don't want to elaborate on the reasons, we need to accelerate the transition to clean, modern, and sustainable renewable sources of energy. I think we will all agree that our dependence on fossil fuels for generating our energy it needs to change if we want to protect our health. So I will start with that, trying to accelerate this transition to clean, modern, renewable sources of energy. Most of the sources of energy, depending on where you are, but essentially is coming from industrial processes related to transport, as Sophie was mentioning, they are anthropogenic, they're related to the combustion of those fossil fuels, and obviously agricultural practices, and in some rural areas is even as well the incineration of waste. And again, depending in which part of the world you are, but most of them are related to this combustion of fossil fuels. The diseases that are caused by exposure to air pollution, again, we have a lot of evidence about, for many years, about how they will impact our respiratory system, causing from lung cancer to acute respiratory diseases, obstructive chronic pulmonary conditions, and even pneumonia. If you are a child, on the back of your mom and breathing all the time this polluted air generated by the combustion of unclean fuels at the household level. But in addition to the respiratory system, we know now that those particles, particularly the PM2.5, that are so small, so teeny, that they will cross our respiratory system, go into the bloodstream, and from there they can cause cardiovascular diseases, particularly ischemic heart disease, go into our brain and then causing stroke. And we have now mounting evidence about damage that they can do to our neurodevelopment and the cognitive system. So I think it's huge, the damage. Essentially, to simplify, we can say that it can affect almost every organ in our body. So this is why this is a major public health issue, and we need to tackle this air pollution, the causes of air pollution, which are very much overlapping, at least on a 75%, with the causes of climate change. So we have a great opportunity here to tackle the causes of climate change, the causes of air pollution, and generating enormous benefits for health, particularly coming from this reduction of air pollution. Sophie, there were other questions that part of the
yes,
question
you were asking about the The 7 million deaths, yes. So you're right. Most of the 7 million deaths, they come from low and middle income countries. Indeed, they do. It doesn't mean that in the high-income countries are not impacted. When we are using mortality to calculate the impact of air pollution on health, however, we are very much aware that you should actually count for morbidity. I mean, all the disease that it creates, all the absenteeism, the lack of productivity. There are a lot of costs associated with air pollution, which is not necessarily captured in the death. I mean, the death is the ultimate, it's the worst, but you have a lot of people who actually suffer from air pollution without dying from it. And we are working towards trying to have an assessment of air pollution from the morbidity perspective, trying to capture the breadth of the disease that are impacted and what it creates on people's health, not only in terms of death.
Just to reinforce the point of Sophie, to give you an example, in the European region, we have every year 400,000 deaths linked to exposure to air pollution. So even in countries considered as middle and high income countries, economically speaking, we still have a major problem caused by exposure to air pollution. Over.
Thank you both very much. Yeah. Our next question goes to Jamie Keaton of the Associated Press. Jamie, the floor is yours.
Good afternoon. Thank you. Nice to see you, Dr. Nera and Dr. Gumi. Thank you for having this. I wanted to follow a little bit up on what Clive had asked, maybe in a different way. In terms of the way that you come to the standard of what good air quality is it based on whether or not we breathe air that can contribute to illness? I mean, how does a country meet these standards if nearly every place on Earth doesn't meet them? I mean, do you have to have pristine mountain air like here in Switzerland? That's my first question. And then I guess Lisa sort of leaned on the second one about what individuals can do. I guess I would just like to maybe ask you about, there are people, you mentioned people burning fuel to cook food and to heat their homes. These are people in places that don't have any alternative in a lot of places. So what can those people do? And what can you tell someone who's, burning these fuels just to survive? Thanks.
Let me start, and Sophie will complement. But you have a very good point. We never wanted to make guilty those who are using polluted fuels at the household level. At the contrary, we recognize that it's a health risk for them, and it's very much linked to poverty as well, and to lack of opportunities for girls, for instance, who need to collect every morning the wood they will use for cooking and for preparing food. Or for heating the house, they are not going to school. So as Sophie was mentioning before, it's a gender issue as well. So we don't want to make them kind of responsible for it. At the contrary, what we want by measuring that and giving the terrible impact that is having on health is to accelerate this transition and access of these people to different sources of energy at the household level. That's why we monitor, we propose solutions, something called CHEST. We look as well at the guidelines in terms of which fuels at the household level will be the ones that will have less negative impact on the health of the people. We work with policymakers to accelerate that transition, and we propose different measures at the governments, and we put the pressure on governments using the health impact and the cost for their society as well, because there is a huge cost for their society in order for them to accelerate this transition to more sustainable sources of energy, cleanest sources of energy, maybe even in a transition as well, allowing those girls to go to school, saving time, saving all the negative impacts on the health of them, and as well making sure that they will have a strategy to reduce that poverty and the diseases that are linked to that. Over. Sophie?
Yes. No, thanks. Yes, I will just complement Maria's response about the pristine standards and how we can reach that. This is a relevant question. When the guideline was developed, the experts they were heavily discussing on how how useful this can be for some countries. This is the reason why WHO is proposing a set of interim targets to be reached before. I mean, even if you should aim for the guideline, at least you have interim targets that you can follow. There is a big point made in the WHO guideline that was released in September, saying that you need to monitor air pollution. You need also to know your sources, and this is coming back to what we said before. There is always be a large share of the source that comes from anthropogenic, even though you have lower level. Relatively low level, like we may have in high-income countries in Americas and in Europe, but you can still do better. And if you look at the NO2 as an indicator to have a big picture, you can see that you can do better, at least with everything that with all the sources from NO2. One thing, and yeah, just to complement again what Maria was saying, we have a very specific WHO guideline on household fuel combustion that exactly treats what Maria was mentioning and trying to really accompany countries to transition to clean fuels. And this gives a lot of guidance about cook stoves, about emission rates, etc. We have a lot of tools that also provide you with the economic benefits of switching to cool. So all those tools, they are available for countries, for government to put in place so that they can accompany and provide a place where people who cannot afford, as you were right to say, and you have really right to point it out, they don't have the choice. This is why the government has a role to play in making those fuels accessible, sustainably, and cheap. Yes, affordable. Over.
Thank you very much. Thank you both very much. Let's go to Elaine Fletcher as well from Health Policy Watch. Elaine, I know you wrote the questions down in the chat function, but you may wish to unmute yourself and ask them if that's easier as well. Elaine, the floor is yours.
Thanks very much. Yeah, I wrote them down so that Sophia and Maria could have a heads up, but I just wanted to check as to hi both of you, and congratulations on this new release of more data than ever. I just wanted to check if the 17% of cities in high-income areas that actually meet or fall below the WHO air quality guidelines, if that's 70% of the number of cities, or is it actually, do you mean to say 17% of the population?
It's the cities.
Number of cities. So it's different than the NOx, the nitrogen dioxide finding, which talks about 23% of the population in the settlements and cities. That's actually population weighted.
I don't know which version you have. We have made it. We have made those calculations based on the number on the cities assessed, right? Not on the population covered. If you have any questions, I'm happy to follow up with you to have exactly the precise figures. I mean, for PM, the number of cities comply are much lower than for NO2.
Okay, so that's number of cities and settlements without any sort of population averaging. It's just the root number of the 6,000. And then for the 4,000 cities, human settlements collecting NO2 data, aggregated, their measurements show that it's only 23% of those settlements or cities, not 23% of the people.
Yeah.
Okay. All right. Well, this is an embargoed version, so just wanted to check that number. So thanks very much for clarifying that.
Pleasure. Hi, Ellen.
Hi, Ellen.
Hi, Elaine. Great to hear from you. Elaine, and you did mention, of course, the embargoed version. The embargo on that press release has lifted, and the report has lifted as well. So that coincided with the press conference, or this press briefing starting now. And thanks for the question as well. Let's go to Jenny Lay Ravello from Devix. Jenny, the floor is yours.
Hi, yes, thank you so much for taking my question. Dr. Gumi spoke of morbidity linked to air pollution earlier, and just want to ask if there's a percentage or a figure you can share how much of the respiratory diseases today, maybe like asthma and lung cancer, are caused by, air pollution. Do you have some figures to share on that? And also, WHO has several recommendations for how to improve air quality. But how much of those are being taken up in the cities? Does the database also show us what's being done in those cities? And what role is there for maybe aid donors and multilateral organizations, including financing institutions, to help in this regard? Thank you so much.
Sophie's taking notes, so maybe I will start with the recommendations and then she can address the first part of the question. Regarding the recommendations, of course, WHO would like to see much more action than the one that is created after we came up with this figure of 7 million premature deaths caused by air pollution. As I mentioned, WHO has been working on that for a long time, and of course the response we see by the countries is probably not at the level of the ambition we would like to see compared with the public health problem that air pollution represents. However, it's true that we have good examples. The number of cities now monitoring the air quality has increased on a very important way. We have some countries, and I would like to mention the example of UK, where now they are going as far as using the legislation. I'm sure that you are familiar with the case of the Ella Kisidebra, the little girl who passed away with terrible attacks of asthma, and now for the first time in history and legislation, in her death certificate not only says asthma, but it says air pollution, and it mentions air pollution as a cause of death. So I think this is a big advancement as well. And we have the European Union, for instance, the European Commission now trying to align and move on a strongest way to implement the new guidelines recommended by WHO on air quality. We have many examples around the world where it's gaining traction, it's gaining attention, it's gaining political power, this issue of air pollution, particularly because we are trying to link it very much as well to the negotiations and the discussions around climate change. WHO put it on the table of the negotiators of the COP26 last year in November in Glasgow, what we call it the health argument for more climate action. And one of the biggest arguments was exactly that, saying that you cannot accept, that you cannot absorb, I mean, it's unacceptable, those 7 million deaths caused by exposure to air pollution, which are coming in a big proportion from this use of those fossil fuels that are as well responsible for the climate change, and therefore we have a triple opportunity to gain for climate change, tackling the causes of climate change, for air pollution, reduction of air pollution, for health, and for the economy now that we need to recover after the pandemic. We need a healthy and green recovery, and this will be one way, a very strategic one to do it, and addressing at the same time this major problem of air pollution. Sophie?
The question of cities you want to take?
Yeah, Western cities, you want to take?
You me?
Yeah, yes, please.
No, thank you for your two other questions. I have them here noted. So one was the role of the cities and how can city work on that. So I think you raise a point. This is also of growing interest now. There is more and more local government who wants to take action about this. And this is great. They may have much more leverage than the national government, so they could take action on a much quicker way. However, what is still difficult is to provide a clear guidance. Source of air pollution are very local. It's very context specific, meaning you have different sources, you have a different topography, you have a different climate, different weather. This will all influence the air pollution and how air pollutants stay in the atmosphere over the region and the city. So it's every specific city has a specific have a specific situation, and the solutions will be also different. So this is why this is difficult to have a fit-to-all solution for the cities. But WHO is strongly encouraging. WHO is working with local governments, with cities network, trying to raise this issue, and also to try to have to serve as a convening power to we have a campaign. We have a raising awareness campaign called Breathe Life, as Hélène may know much better than anyone, where we are trying to put cities together to create a network so that cities can share their experience and what works and what didn't work. Having a specific guidance as I said, on something that will work anyway, it is not yet ready. It's not yet available. Not sure it will be once, but WHO is trying to work with partners on trying to have the most guidance and advice for local government, how they can what they can do. There is out there in the literature with partners some reports that trying to accompany cities and local government metropolitan areas with a guide with a stepwise approach on what to do for that. And finally, your last question was about figures on morbidity. So this is a good question. Morbidity it's very difficult to get actually good data on morbidity. Even mortality is already difficult. Morbidity is even more difficult, even in high-income countries, to get a sense of the exact data, because this is not data that is necessarily compiled at the government level. This is based on hospital admissions. This is general practitioners who have this data. So this is very difficult to have a very precise overview of the impact on morbidity. WHO is trying to, together with partners, to work on a project to try to develop this economic cost of morbidity from air pollution, and this is something that together with partners and experts we are trying to develop a methodology so that we could come up with some figures. There are some figures in the literature for asthma due to NO2 or other examples. There are a few. If you wish, we can also follow up bilaterally, but there is no common global numbers that we are promoting at that stage. Over.
Just to maybe, while Sophie was talking, I remember as well that the major efforts we are doing with mayors in the big cities. I'm sure you know the C40, and now the mayor of London is the chair of this big group of C40s, which put together the biggest cities around the world. We will include cities from the south as well, and we will be working together on something called solutions. So I don't want to disclose too much information here, but we are mobilizing and the mayors, and they can take very strong measures as well, helping us to reduce air pollution at the city level. And because they are so close of the citizens, they are the ones that then can claim how can they contribute to reduce the major damage to the health of the people that is causing exposure to air pollution, and by doing so gaining more motivation and obviously more support by their citizens. It's an important strategy to try to reduce. If you are a mayor, reducing the air pollution in your city is definitely a big priority for many of them around the world, and we will be trying to push them to go even for much more. Over.
Thank you both very much. It looks like we're actually coming to a close of our press briefing. We've had some really, really excellent questions from journalists. Thanks to all of the reporters who have taken time to tune in and ask questions. Of course, thanks to our experts, Dr. Neira and Dr. Gumi, also for their insights on this all-important database as well, of course. And if you'd like to find out more, of course, please, or if you do have any follow-up questions, do email us at mediainquiries@who.int, and we'll be more than happy to follow up with those questions for you as well. As we've mentioned earlier as well, the embargo has now lifted as well, so please, we do look forward to seeing your reports and reportage on this as well, and please do keep in touch and have a great day and week ahead. Thank you very much.
Thank you.
Thank you.